Yeah, hi everyone. Welcome to my YouTube channel. My name is Dr. WAN, and I'm here today to talk about plant-based therapy, or what some call it lifestyle medicine, to be more precise, plant-based diet therapy. I know so many people prefer going the pharma route, which is not bad, but it has some limitation in the sense that you need the money to buy the medication. That is, you go to the pharmacy and get this medication prescribed by a doctor, meaning that if you don't have the money, it won't be possible for you to get this medication. So I have decided to come up with plant-based therapy or plant-based diet. As you can see on my thumbnail, there is one container that has plants there. You can see some fresh pumpkin leaves, and the other one already prepared as salad. The most important thing here is for this to be crunchy. If you have to cook it, it should be half cooked. Otherwise, I would say eat it as salad. It will go a long way. Now, why do I insist on eating crunchy or eating plants raw? Plants do contain some chemical structure. If you heard about me talking about antioxidants, they are highly loaded with antioxidants. So that's why I am insisting that you go plant-based therapy, especially for those who are over 50 years of age. Is very important. Now, let's look at the physiological structure of your body, especially your heart. Your heart is like an engine of a brand new car. Remember, a brand new car can never remain the same car if you don't do some maintenance. By taking this car to a mechanic, do what we call oil change, check the tires and everything in order for this car to move perfectly. Human beings also suffer from this same aging condition, which we call it apoptosis. Apoptosis means programmed cell death. So the older you become, the higher the risk of you suffering from apoptosis. And that's why I am encouraging each and every one to make use of plant diet. Now, let's look at the human heart. The vascularization. There are some things like wires or cable around your heart, which we call them the coronary tubes. Those coronary tubes, they undergo aging as time goes by. And a classical example is plaque. That plaque builds up based on our lifestyle. For that reason, I entitled this video Lifestyle Medicines. When I talk about lifestyle here, I'm referring to what we eat on a daily basis and also exercise. When you choose to go sedentary life, your cholesterol will definitely spike. But when you are physically active, that value obviously will plummet. I'm not by this saying that you cannot have high cholesterol if you are physically active, but one of the factors is physical activity, reduce sedentary life, get yourself rehydrated, and also eat decently and responsibly. So, in the event that you choose to do the opposite, you are at high risk of having plaque, and that plaque now tends to what we call atheroma. And when this atheroma builds up, the tissues, your capillaries, the arteries, they all undergo what we call sclerotization. When they become sclerotized, they lose their flexibility. So there's kind of hardiness within the arteries and the capillary, and that's why you are at high risk of having serious cardiac disorder. Whereas if you go vegan by reducing the intake of animal protein and live on plant, there's just no way you will suffer from this condition. The chances are so slim. Like I said, plants are highly loaded with antioxidants, as like the flavonoids, the famous nitric oxide. Nitric oxide is a great scavenger. Scavengers in layman terms are just like plow truck. That's the snow plow truck that goes around the way and clear away snow for traffic to be able to move. So when you practice this habit of consuming plant-based diet, which is crunchy, as I've always said, you won't find yourself in a bottleneck situation. Bottleneck situation is a scenario where 5 cars are moving on a driveway. Now, at some point, those 5 cars cannot move alongside because of work is ongoing. So there's kind of restriction. And when there's restriction, there's high chances of you involving in an accident. So that's the exact same thing that happens with the coronary arteries of your heart. So heart attack, heart failure, and a lot of other things happen in the exact same way because there's that plaque building up and the blood now doesn't flow regularly. So that's where strokes comes in and other medical complication. And the worst case scenario even is when the plaque now breaks up and end up in your lungs. That makes it even more critical. So this video is meant to avoid such situation. So when you go the way I'm saying by eating plant-based diet, plant-based protein, you won't find yourself in that situation. Now, the next question is, how do you prepare this plant-based food? It's quite simple. The first thing is, you make sure that they are all organic, not GMO. GMO stands for genetically modified organism. So that's the meaning. So it should be organic plants, the one you grow them yourself, or you are sure that your supplier prepare them the right way. So that's the first thing. Now, you get them ready as salads. For those who find it hard to be eating salad every day, you can now prepare them half cooked. You can see my thumbnail. The salad has varieties, kind of a mixture of other stuff which are all important for your health. You have the garlic, you have the onion, you have the ginger, and I will say even some black beans also should be added there. Those of you living in the US, you can get kale. And remember, never you cook kale. It should be eaten raw. Cauliflower, same thing also, should be eaten raw. Broccoli is the same thing also. For those of you in Africa, don't worry. There's what we call bitter leaf. Bitter leaf will help you a long way. Bitter cola will help you the same. Cocoa nibs will also play a greater role. So you make it a habit that every day you eat just a smaller quantity of these things I've named, preferably in the evening before going to bed. That is, it should serve as your dinner. That's my recommendation. And keep doing that. You won't see the result after 2 days, but rest assured that within 3 to 6 months, you would see some changes. And the evidence is when you climb a staircase. Remember my experiment on staircases, that you have to climb up and down at least 3 times a day. Those who are suffering from endothelial dysfunction, when they climb those staircases, they find it hard to breathe. Some even find it hard to stand. So if you go up these staircases, up and down 2-3 times a day, and you find it hard to breathe, then it means that you are suffering from that condition which I call endothelial dysfunction. And something has to be done. If you have your money, then you need to see a cardiologist. For those who don't have the money, plant-based therapy is the best solution for you. You might not need medication, but you go on plant-based. It takes time. It might take you 3 months for you to see the result. Those who have the money to see a cardiologist, they will definitely put you on some medication that will help to improve on your situation. So that's the reason why I choose to make this. And remember, erectile dysfunction will not be a problem to you anymore because you are eating plant-based. And like I said, plant-based is highly loaded with nitric oxide. And the nitric oxide now helps as a booster to make blood circulate on all over your body. So that's the good news here. Make sure also you get some watermelon. The watermelon contains what we call citrulline. The citrulline now is a precursor of nitric oxide. So you see the advantage that I'm saying. Same thing also for garlic, same thing also for onion, same thing also for ginger. Ginger, in fact, is a booster. So when you get your ginger in your meal, if possible, crunchy one, not cooked, it makes it even more efficient. Blood flows perfectly. So that's the message for you. Make sure you practice what I'm saying. And feel free to subscribe to my YouTube channel. Ask as many questions as possible, and I'll be more than happy to help you. Once more, my name is Dr. WAN. Again, share this information with everyone. I'm here to guide you, and I want you to be safe. Remember, there is only one you. Keep it at that. Thank you, Dr. WAN.